The Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. Are doctors and nurses having more say in how the health system is run?
Honourable Tony Ryall.
Mr Speaker, yes, and in part that's because under this government there are over 1,000 extra nurses and hundreds of extra doctors.
The Honourable Ruth Dyson.
Does he support the view of Kevin Woods, recently appointed Director General of Health, that many doctors and nurses' positions can be cut without compromising health services? And if so, in which areas are these surplus doctors and nurses to be found?
The Honourable Tony Ryall.
Mr Speaker, Mr Woods' comments no doubt reflect the circumstances he has from his government in Scotland. What I can say, under this government in New Zealand, we have employed since the election over 1,000 extra nurses and hundreds of extra doctors.
The Honourable Ruth Dyson.
Who are doctors and nurses more likely to have confidence in? The 29 New Zealanders who were shoulder-tapped to lead the ministry but declined.
Order. I apologise to the member. I must say I'm not terribly impressed with the way the sound system is working today because I'm struggling to hear members, but the level of interjection is not helping. That just got totally out of control, and the House has been very well behaved until just the last couple of minutes. But I'd ask the Honourable Ruth Dyson please to repeat a question, and I'd ask members to be reasonable in their interjections. The Honourable Ruth Dyson.
Thank you, Mr Speaker. Who are doctors and nurses more likely to have confidence in? The 29 New Zealanders who were shoulder-tapped to lead the Ministry of Health but declined the job, or Mr Woods, who oversaw the plan to slash 4,000 frontline health jobs in Scotland?
The Honourable Tony Ryall.
Mr Speaker, I think New Zealanders can have confidence in the decision of the State Services Commissioner to employ Dr Woods. What I can confirm is the reported comments of the Director of the Royal College of Nursing Scotland that Mr Woods, quotes, leaves the NHS in Scotland in a better place than it was when he arrived, unquote, which is certainly not something that New Zealand doctors and nurses would say about that party opposite when they were in government.
Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health, what improvements have been made by giving doctors and nurses more say in the public health service?
The Honourable Tony Ryall.
Mr Speaker, a good example is the 2,500 nurses now involved in the Releasing Time to Care program, which in some parts of the country is doubling the amount of time that nurses spend with patients. As a result, the patients are getting better care, getting back to their families sooner, and fewer are being readmitted back to hospital. That could not happen unless there was the leadership being shown by New Zealand nurses up and down wards throughout this country.
Honourable Ruth Dyson.
Was there any consistency in the reason that so many people declined to take on the role of Director General during the shoulder tapping? And if so, has the Minister of State Services advised him of the reason?
The Honourable Tony Ryall.
Mr Speaker, what I could tell the member opposite is she can make up as many stories as she likes about this, but Dr Woods inherits is coming to a job where there are over 1,000 extra nurses and hundreds of extra doctors and hundreds of extra services being provided in hospitals throughout New Zealand.
The Honourable Ruth Dyson. Now order.
When he told nurses last year of his lean thinking pilots, was he actually intending to warn them that they'd soon be working longer and harder and many of their colleagues would lose their jobs?
The Honourable Tony Ryall.
Mr Speaker, when there are over 1,000 extra nurses employed in the public health service since the election and hundreds of extra doctors being employed in the public health service, the only people I'm aware who are losing their jobs are a large number of managers throughout the bureaucracy.
Question number 6, Nicky Wagner.